This segment is sponsored by VCU Health.
The doctor is in and you have questions. All of this week, all of the adults in Virginia are now eligible to receive the COVID-19 vaccine. Dr. Jeffery Donowitz, a VCU health expert in infectious disease, joins us talking more about the vaccines, their safety, their effectiveness, and all related to COVID-19. It's great to see you, Dr. Donowitz. Thank you for making time.
Yeah, good morning. Thanks for having me.
Our pleasure. You know, this news continues to unfold right before our eyes. As of this week, all Virginians are eligible. Can you bring us up to speed on what is being offered and the status?
Sure. So right now in Virginia, there are two vaccines being offered. One is the Moderna and one is the Pfizer. The Johnson & Johnson is currently on pause as the FDA and CDC review some data concerning blood clots that flagged up in our reporting system about that. But currently the two vaccines, so if you get a vaccine in Virginia this week, it'll be one of those two, Moderna or Pfizer.
It really is incredible. All of this is happening before our eyes. It's very dynamic. None of these vaccines were around a year ago, and that certainly is top of mind for so many. What kind of safety standards are in place before these vaccines are approved for public use and really put into play? And you mentioned monitoring as they are being administered too.
Yeah, that's right. So we didn't have any of these vaccines a year ago. And we actually knew that the likelihood of a coronavirus epidemic or pandemic was high, given our experience with SARS-1 and MERS. So we were working on the coronavirus vaccine science long before COVID was a thing. And that allowed us to really move quickly to get these vaccines out into people. And after that initial lab work, there's a phase 1, which is a very small study, about 50 participants. If everything looks good there, moves to a phase 2, maybe 500 to 1,000. And if things continue to look promising in terms of efficacy and safety, it moves to the big phase 3, which many people have heard about, with 30 to 40,000 participants in them. I think the thing that most people don't realize is, based on that phase 3, the vaccine may be allowed to be used in the general public, but we never stop monitoring them. We never stop studying them. And that's how we catch 1 in a million, adverse events that the phase 3 might have missed. And that's what happened with Johnson & Johnson this week. You catch a pattern that maybe wasn't seen previously.
So in a way, while it may become concerning to folks, maybe it should be reassuring that they are continuing to be monitored and evaluated so that we know more about the efficacy. Let's talk specifically about what happened in the case of Johnson & Johnson.
Yeah, so our monitoring system that was looking at all those 6.8 million doses that were given in the U.S. picked up a pattern of these strange blood clots, these rather rare type of blood clots. And that pattern was enough for the FDA and the CDC to hit pause on administering the vaccine while they go back and look at those cases, those 7 cases, so right around 1 in a million, to determine whether those blood clots were indeed due to the vaccine or whether that pattern was due to something else. But in the meantime, you pause until you can sort that out. And I agree with you. I find it very comforting to know that the guardrails that were designed to catch 1 in a million effects are working. And that's exactly what happened.
And in the case with the Pfizer and Moderna, let's talk a little bit about the safety of those 2-dose applications. Anything that we need to know with those?
Yeah, so I think it's important to realize that those same guardrails are in place for those 2 vaccines. We haven't seen any of these clotting events despite over 100 million doses given, so a lot of data. We haven't seen that. We actually haven't seen any other adverse events that would make us want to hit pause the way the FDA and CDC did with Johnson & Johnson. Those vaccines certainly have some side effects. You may get a fever, chills, sore arm, headache, feel bads, those type of things. But those are relatively mild. And when I say mild, I'm not saying that they're not uncomfortable, but they're not going to hurt you in the long run. And I certainly can't say that for the virus itself.
Dr. Donowitz, we're pretty much out of time, but I do want to ask, even though this is dynamic and we've talked about guardrails, this has been a very informative conversation. What would you say to anyone who is hesitant about getting the vaccine?
I get it. This vaccine was brought to market very quickly, and that makes people nervous. I think what I would tell people is that all of that lab work that was done based on SARS-1 and MERS allowed us to bring this to market in a way that didn't compromise safety. Any time in human history where we've been able to beat an infectious disease, whether that was smallpox or polio, was due to a vaccine. And this vaccine is our best chance at getting our social lives back to what we want them to be, getting our economy back to what we want it to be, and putting this last year and this pandemic behind us. So get your vaccine. And until everybody has had a chance to do so, continue to wear your mask, wear it properly over your nose and mouth, put it on when you go into public, don't touch it or mess with it, practice social distancing where you can, and wash your hands.
Thank you so much for making time to talk with us. We appreciate you, Dr. Donowitz.
Thank you so much for having me.
Absolutely. We're going to share a little bit more information so you can learn more. Feel free to log on and learn more about VCU Health. You can visit online, vcuhealth.org. And stay right here. There's still much more Virginia This Morning coming up.